Good afternoon and welcome to our program, Let's Talk About Self-Care. My name is Shanae McPherson. I'm the Volunteer Connect 55 Plus Administrator for Orange County Department on Aging. And on behalf of the department and on behalf of the Project Engage Mental Wellness Senior Resource Team, I would like to thank you all for joining us this afternoon. Thank you to our director, Janice Tyler, who is here. For her continued guidance and support. And also thank you to our Department on Aging staff for your continued support. A very special thank you to our presenter, Ms. Annie Deaver, for sharing her knowledge and her wonderful energy with us this afternoon. Thank you. In celebration of National Self-Care Day, we're going to focus on the importance of taking a little time to care for ourselves. This past year has been difficult, as we all know. We've all been impacted in some way by the pandemic and had it disrupt our work lives, our connections to family, to friends, and impact both our physical and mental health. Learning to focus and practice self-care could not be more important or needed. Today's program will guide us through acknowledging and valuing ourselves and provide us with some helpful tips on how to ensure we are creating healthy lives. It is my pleasure to introduce our presenter this afternoon, Ms. Annie Deaver. Ms. Deaver is a for-profit and not-for-profit healthcare leader with over 20 years of experience. Ms. Deaver holds a BA in Sociology and Health Services Administration and also holds her MSW with a concentration in mental health. Additionally, she holds a certificate in trauma counseling and is a 2016 Health Fellow with Health Foundation of Western and Central New York. Ms. Deaver has instructed at the graduate level and facilitated countless workshops on conflict resolution, self-care, and mental health in communities of color. She relocated to North Carolina, Raleigh, North Carolina, from Buffalo, New York in 2017, and since has worked for local government and now within an assisted living community where she is the Associate Executive Director. Ms. Deaver has a passion for women's empowerment in underserved communities. And I cannot thank you enough for taking the time to be with us this afternoon. This definitely brings back old memories, so it is wonderful to have you with us this afternoon. So Annie, without any further ado, I will turn it over to you.
Okay. Thank you, Shanae, and good afternoon to everyone on the call. I have to give a special shout out to Orange County Department on Aging and Janice Tyler as the director and Shanae McPherson as the Volunteer Connect 55 Plus Division Administrator because I used to work there. I was the Aging Transitions Administrator for about a year and a half. And I left probably about a year and a half ago. So it's funny how time flies. So for me, this is full circle. I feel like I'm coming back home to family. So thank you for inviting me to present today. And I also want to give a special shout out and thank you to the Project Engage Mental Wellness Senior Resource Team. When I worked at Orange County Department on Aging, I just used to always kind of stick my nose in and insert myself into the meetings and, just to listen in and learn. So thank you for just welcoming me back. So we're just going to jump right into the first slide. And as Shanae mentioned at the outset, if you have any questions, and I know questions may come up throughout the presentation, I would really appreciate you either sticking them in the chat for Shanae to address at the end of the talk, or if something even pops up after the presentation is done, I'm just going to ask Shanae to send those questions to me, and I'll be happy to, respond to you all individually. So I know with the advent of the COVID-19 pandemic, you all probably have had the opportunity to invest in your self-care a little bit more, or maybe not so much. And I'm hoping that we can share some best practices among the group of participants after the call. So I'm just going to jump right in. So self-care, let's talk about self-care. And as Shanae mentioned, since I'm hoping on the downturn of this pandemic, I'm hoping that we're coming out on the other side, right? There's a lot of course, anxiety and fear around maybe what this Delta variant may do. Are we going to find ourselves needing to mask up a little more, or maybe to isolate ourselves a little bit more? So hopefully, this is a timely topic. And hopefully, whatever little tidbits you may learn from this talk, I hope you can not only incorporate into your own lives, but to help you in supporting your friends and family members if we in this country may need to isolate ourselves a little bit more. Okay, so today for me is really about a conversation. I'm looking forward to learning from you all at the end as to what you have been doing and what you've instituted in your life. But just to give you an idea of what we're going to talk about today, we're going to talk about why we should take time for self-care. We're going to talk about a couple of strategies to prevent or avoid burnout. We're going to talk a little bit about self-care for caregivers or care partners. We're going to talk about the COVID-19 pandemic and how that has affected self-care, or how that has affected the ability of people to not be able to necessarily provide self-care like they used to. We're going to talk about building resistance and round things out by identifying some community resources. Next slide, please. Okay, so what we do know is that poor self-care is absolutely a slippery slope, which can lead to an array of other, mental, physical, and or emotional conditions. So self-care, if we practice it well, tends to improve our immunity. And right now, since we're in a pandemic, there's a whole lot of research out about how, what you need to do to boost your immunity. Do you need more vitamin C? Do you need more zinc? Do you need more exercise? And I guess the short answer is probably yes to all three of those and more. Also, self-care, there's a lot of research around positive thinking and positive self-talk. How, our mind, those words that we feed our mind, how those things can adversely affect if we're negative talkers, or more positively affect our health, mental and physical, if we're more positive self-talkers. We do know that if people practice more self-care, they are less susceptible to stress, depression, anxiety, and other emotional health issues. So it's really important to take time out to care for ourselves. And this helps remind us and others that our needs are important too. So I'm going to emphasize that. Our needs are important too, because what we're finding, most especially in this pandemic, is that people are not only trying to figure out how to care for themselves, but they're also caring for others, right? You have people who are working from home more, or working virtually. You have people who are caring for school-aged children at home. So there are a whole lot of compounded stressors right now. So people are really having a hard time, as you can imagine, trying to figure out how to carve out time to take care of self when you're trying to juggle so many different things right now. Next slide, please. Okay, let's talk about the practice of self-compassion or self-care. So sometimes those terms are used interchangeably. So we're just going to talk about, a little bit about self-care or self-compassion. So what we do know, as we get on an airplane and we hear those instructions, I don't think it can be said enough that we have to first put the oxygen masks on ourselves, right? So in order to be able to provide care for others, we have to take our mental and our physical and emotional health as important. It is high priority. And what happens very often when we are providing care for others, or even just taking care of ourselves, we tend to put ourselves on the back burner. We don't care as much about sleep, even though we know we need 7 to 9 hours a day. We're certainly not moving our bodies as much. And with being more isolated, sometimes you're just more lethargic. You just don't feel like getting out as much. And then that becomes a slippery slope. And then frankly, sometimes, when we were in a pandemic a year ago, a lot of us were trying to figure out, I want to leave the house, but where do I go? I mean, everything's closed. We're not visiting family. We're not visiting friends. So, there was a lot of folks who became way more inactive physically during the pandemic. There are a lot of people who gained weight during the pandemic that they're trying to get off their bodies right now. There are a lot of people who had a diagnosis of depressive disorders, mood disorders, anxiety disorders with the advent of this pandemic. So being kind to yourself builds the foundation to self-care. Self-compassion means giving yourself credit for tough, complex work, stepping away from the self-critical, harsh inner voice, and allowing yourself time, even if it's just a few minutes a day, to take care of yourself. So when we're talking about self-care, even if it's something like exercise, I don't know if you're anything like me, but you sometimes think to yourself, well, how can I fit it in? I don't have an hour a day, or I don't have an hour and a half a day. But what we do know is incremental little things reap huge benefits for our mental and physical health. So even if we're talking about 10 minutes in the morning or 10 minutes at night, it doesn't have to be, and I'm talking to myself too, it doesn't have to be 1 hour at the gym every day. It could be a little walk, right? So I've been trying to walk my neighborhood more. I don't do it. I'm not up to 4 days a week, but at least you're getting out, you're getting some sun, you're getting some vitamin D. That's also an opportunity to socialize and chat with people, right? So I'm hoping by the end of the talk, we can come up with 1 to 2 additional things that we can maybe add to our toolbox just to get us moving again and to get us a little bit more healthy. Next slide, please. Okay, let's talk about how to incorporate self-care. So as I mentioned a little bit earlier, it's really not about that 1 hour at the gym every day. If you can do it, that's wonderful, it's all well and good, but what we want to do is we want to kind of come up with more realistic, bite-sized chunks of ways that we can incorporate more self-care into our lives. So here's what we do know. I found some really cool, interesting articles and information online, which at the end of the presentation, you'll see a couple of reference slides, which I know Shanae's going to share everything. So, at your own leisure, you can go into some of the sites and some of the resources that I found. But what I found is one of the best things to do to improve the chances that you incorporate more self-care practices into your life is to do something the first thing in the morning. And I know it's not rocket science, but if you set your alarm a little bit earlier, or if you're just an early riser in general, if you can get a little bit of self-care practice in the morning, you're going to be a whole lot more likely to stick to it, and you already have it out of the way. So you can't really use that excuse that, end of the day, I just don't have time to fit it in. If it's already part of your morning routine or on your morning calendar, you're going to get it out of the way and it'll be done. Another way to do that is to be a little bit more intentional about it, right? Be deliberate about it, plan it, write it on your calendar, set a realistic goal. Don't make it too lofty, like I need to get up an hour early, 5 or 6 days a week. It could be, I'm going to get up 30 minutes earlier, 2 mornings a week. You know what? And the more you start incorporating those small changes into your life, A, you're going to reap more benefits immediately. And B, also, you may want to layer another day on and another day on, and then it becomes just an easier practice for you. And you can kind of model those behaviors, depending on who you live with, a partner, a grandchild, an adult child. It's good to kind of practice and model those more healthier habits into your life. And then you can more positively impact the life of someone else. Another way of incorporating self-care into your life is to get support and to find a partner. Now, I don't know if you're anything like me. I was way more likely to exercise when I had a friend calling me or knocking on my door to kind of get me up in the morning. Sometimes it's just really hard to motivate ourselves. So if you're that kind of person, try to find a partner, a friend, a colleague, a co-worker, someone from church, a neighbor, someone who can help to motivate you. And then the two of you can become partners in whatever self-care practice. So Don't get me wrong. I'm not just talking about exercise. It can be any kind of mindful activity. It could be, spending time in nature. It could be, a member of a book club or some kind of virtual support group, anything like that, where you can partner with someone. And if it helps to get you healthier, and if it helps to help you to practice more self-care, that's going to be a good thing. So what I want you to think about for questions at the end, just to generate some conversation, think about some ways that you have been more intentional during this pandemic to practice self-care. Or if you haven't been very intentional, tell me about, or let's talk about some things that you would like to incorporate into your life. And let's see if we can figure out how to increase the chances that we can do that together. Okay, next slide, please. Okay, let's talk about 8 areas of self-care. And this is a resource that I found online last week from Modern Therapy Online. So just to provide a little bit of context, when it comes to, older adults who are living alone, 28% of older adults live alone. Now, just because an older adult is living alone, it doesn't necessarily mean that that older adult is more isolated, because we do have a good number of older adults who are really engaged, like some of you today. You may be involved in the mental wellness SRT, you may be involved at senior center activities at Passmore Center or Seymour Centers, or you may be really engaged in volunteer work and the like. So I'm not trying to say that most older adults are who live alone are more isolated, but there's certainly a good chunk of older adults. So 28% of older persons live alone, 9.3 million women and 4.5 million men. And I'm sure some of you can guess the reason why more older women are living alone. And it's because women, of course, by and large, outlive men. So more women happen to live alone. So let's kind of dig in to the 8 areas of self-care. So I'm going to kind of go individually. So we're going to highlight physical, psychological, emotional, social, professional, environmental, spiritual, and financial. We're going to talk about each of those areas, and I'm going to give you a couple of examples of those areas as they are relative to self-care. So when we're talking about physical self-care, here are some examples of some things that you can do. So with physical self-care, we're talking about movement of the body, health, nutrition, sleep, resting needs. So some examples of ways that you can incorporate more physical self-care in your life is to go for a walk, take a bath, getting enough sleep. It's still recommended that we need 7 to 9 hours per night, and to eat more balanced, nutritious meals. Now, we know you may not be able to incorporate all of those, but just a couple of those, or if you could try one. And if you're anything like me, getting enough sleep is probably my biggest area where I need some work, right? Not only because of the age that I'm at right now, so I'm kind of tossing and turning, but also because sometimes I find myself on social media too late or watching television too late. And believe it or not, that disrupts the brain waves that kind of get us to sleep and resting at night. So what I've been trying to do, even in talking to my doctor, is to practice more sleep hygiene, shutting down an hour or so before bed, coming up with some bedtime routines, like reading for a while, shutting that television off. And as a result, I have been able to get more sleep. I'm not quite up to the steady 7 to 9 hours, but at least I'm getting there. So one way that we can help to build our psychological self-care is to practice more mindfulness, to maybe read a book. That may include, joining a book club with a partner, learning a new skill. And as I kind of alluded to earlier, practicing some of the digital detox, getting off the phone, getting off of social media, getting off those tablets that are sending those blue lights to our brains that are just kind of keeping us restless more. So when it comes to emotional self-care, we're talking about enhancing emotional literacy, navigating our emotions, increasing empathy, managing stress effectively. So some of these examples are, this is huge, learning to say no and to set limits on our time. Sometimes we can overcommit. Making time every day to reflect on your feelings, maybe coming up with a journal or something like that so you can write your feelings down. And being aware of your own emotional boundaries. So to come up with ways to protect your emotions, because our emotions can be fragile, of course, and we need to protect those by setting boundaries for ourselves. When it comes to social self-care, we're talking about having a supportive group and network of relationships around us that you can trust and turn to. So some examples are honoring your commitments to other people, asking for help when you need it, practicing meeting new people, which has been a challenge we know during the pandemic, but now that the pandemic's lifting a little bit, figuring out ways to meet new people. And now, again, we can spend time with family and friends a little bit more. So incorporating more of that into our lives. So when we're talking about professional self-care, we're talking about sharing our strengths and gifts, having clear professional boundaries, and living our purpose. And we can do that by eating a nourishing lunch every day, going for a walk, having clear professional boundaries, and as much as possible, attending professional developing opportunities as you all are doing today. When we're talking about environmental self-care, we're talking about having an organized, well-maintained, clutter-free work environment as much as possible, and creating a space in your home environment, having clean clothes, a clean and well-tamed mode of transportation, and things of that nature. So monitoring your technology time, cleaning up after a meal, taking time to wash those dishes, taking time to wash clothes, and to try to maintain a clean and safe living environment for you, your partner, and or your loved ones. Spiritual self-care encompasses having a belief system and values around things that are important to you and things that guide your life. So some of these things may include meditating, reflecting in a journal, going on a retreat, or walking in nature. And lastly, when it comes to financial self-care, this is about being responsible with your finances and having a conscious relationship with money. So what that means in part is knowing where your income comes from and how it comes in, knowing where your expenses are, what's due, and paying them on time as much as possible, completing your tax responsibilities, and spending and saving money as wisely as possible. So those are just some of the ways that we can practice financial self-care. Okay, so that's it for the 8 areas, and we could talk a little bit about that more at the end if some of you have questions or comments about that. So next slide, please. So just a few of these I'm just going to name. When is it time to ask for help? So when we're talking about self-care, it's really important that you're at least tuned into yourself or to your loved ones enough to know when it's time to maybe raise the flag and say, you know what, I need a little bit of extra help. We spend so much time focusing in on others. Sometimes we become secondary, as we mentioned before. So just so you know, any one or all of these or a couple of these could be an indicator that you should seek some additional support. So if you are feeling tired very often, feeling overwhelmed, if you found yourself worrying a little bit more, if you've been feeling more sad, if you have experienced, which is not listed here, if you have experienced a loss, some of us have experienced losses over the past year or so, because of the COVID-19 pandemic. So we're talking about possible losses of loved ones, and also a loss of some of our finances. There have been some financial changes during this pandemic. There have been changes, losses as far as social connects, with us being a little bit more isolated. Those may be some causes to kind of raise the flag and get a little bit more help. Also, if you or family members have noticed, significant weight loss or weight gain, has your appetite changed? Is it harder for you to feel full or satiated, like satisfied? Have you been having more somatic or like body pains, bodily symptoms, backaches, headaches, those kinds of things? Have your sleep patterns changed? Too little, too much? Those kinds of things you need to pay more attention to. Have you noticed, or has anyone mentioned to you that you're a little more easily irritated? Or if you've been a little bit more angry, a little more defensive, those are things that you need to pay attention to either in yourself or in someone else. So it doesn't mean that you need to have all 9 of these areas to ask for help. It may just be one. It may just be like 1 or 2. That may be cause for you to try to seek some additional support in the community. It's always a good place to start with talking to your primary care provider and reaching out to your personal supports, your support system, to see, how you can get some help for yourself or your loved one. Next slide, please. Okay, next we're going to talk about some tips to avoid burnout. We're going to talk about, how to avoid burnout for caregivers or care providers, and then just some general tips on how to avoid burnout. Next slide, please. Okay, so this first one is really focused on if you are a caregiver or care partner, or maybe if you have a chronic condition. Please become educated about your chronic condition or your disease or something that you've been newly diagnosed with. We're talking about whether it's a physical health or if it's a mental health related diagnosis. Educate yourself. Jump into an educational support group. Ask your provider for reading materials. Go online and do a little more research. I would caution you a little bit with going online too much, because if you're anything like me and you go to WebMD too much, you just overdiagnose yourself. I've had myself diagnosed with 20,000 different things from WebMD. So I'm just going to caution you there, like talk to your provider. And then, pull a whole lot of different other, resources from your providers to your friends, if you have a counselor or therapist, and, just kind of educate yourself more than anything. This is easier said than done. We've kind of been talking about this already, to take care of yourself first as much as possible. So remember, again, that whole adage of putting that gas mask on yourself first. You have to learn how to be good to yourself first so that you can really be good to other people. And some of this may seem repetitive, but I don't think we can repeat it enough. Practicing more healthy living, staying more socially connected, accepting help, and two, acknowledging your own emotions. And it's okay, different parts of the day, your emotions may be in different places. So take note of those trends. So if you're especially sad in the morning, or if you're especially sad in the evening, just, more sad on the weekends. For me, Sunday evenings used to be a little bit of a sad time for me during the pandemic, because I was so used to going to church and running around on Sundays. And I found myself doing virtual church on Sundays and not going out as much. So I started noticing some of those things just in me. And I needed to kind of link with some more people for some more social support. So, it's okay. Like, acknowledge your emotions and acknowledge that things have changed, and then figure out a way to try to gather some supports and some resources for yourself. Next slide, please. Let's talk a little bit more specifically about self-care for caregiving or care partnering, because I know some of you may be providing some caregiving for a partner or a spouse. You may be providing some care for maybe school-age children. Maybe you're providing maybe babysitting or just helping your children out by caring for your grandchildren. And some of you are even taking care of pets, right? I don't think we should not acknowledge our pets. Those are our babies too. So depending on what kind of care you're providing, let's just talk about some ways that you can continue to provide some self-care. Next slide, please. So just why self-care? Just some kind of basic stats and the impact of self-care. So caregivers sometimes describe themselves as the forgotten member of the relationship or family, right? So caregiving itself can be very lonely. So providing self-care, when you are providing care or partnering for care with someone else, can make, folks feel left alone, which is why I'm so happy that there are so many great services at Orange County Department on Aging, just to provide some support through the Aging Transitions Division and the division of the VC 55 plus. Caregivers also often feel a significant demand and burden on their own endurance and coping mechanisms. Again, you're providing care for yourself and you're providing care or partnering in care with someone else. And then on top of that, there may be some financial strains. And then to add to that, some caregivers or care partners are working outside of the home. So it's like you're working and then you're coming home to work again. So that absolutely will make it really challenging to provide self-care. And we also have to acknowledge that some people are working as professional caregivers, like where I work right now in an assisted living community. We have people who are professional caregivers, and then they go home and provide care for kids, or they go home and provide care for parents. So if you can imagine, that's like a compounded situation where self-care feels almost impossible. So there are exponential stressors right there. So, for those folks, we absolutely need to figure out some kind of way, whether it's through respite services or more family support, community support for those folks to be able to some kind of way carve out caring for themselves. Next slide, please. Okay, so why self-care? While family members anticipate a time when they will have to care for a member, few anticipate managing this reality at the point at which it occurs. So what this means on the whole is that all of us, kind of in the back of our mind, we think that, okay, at some point I'm going to have to provide care, but very often it happens way sooner than we anticipate. So here I am, I'm 51 years old now, and my mom is well into her 70s. And at some point, I'm thinking that I may have to provide some care for my mom, but I'm already beginning to realize that, that may be happening sooner rather than later. So for me, it may seem like it's far off, but the older I get, it's getting closer and closer, right? And it also causes me to have conversations with my children earlier, to be a little bit more proactive with ways that I can stay independent longer, right? And, hopefully I can, keep myself more independent. And then also I need to figure out how to start providing a little bit more support for my mom. So it's coming, right? It's coming for a lot of us, and a lot of us are actually living it right now too. So again, the more that we kind of equip ourselves with resources and we start practicing more care, we'll be able to do a whole lot better job. Next slide, please. Just some basics about self-care and caregivers. 60% of caregivers in 2015 were employed at one point while also caregiving. So again, it just kind of goes back to the whole idea that, for most caregivers, they're working outside of the home. So again, working and then coming home and working again. Okay, a few more stats. Next slide, please. The average caregiver spends 20 hours per week caregiving, and 66% of family caregivers are women, and remarkably, 65% of care recipients are women. And I think a whole lot of that has to do with the fact, again, that women are living longer than men. Fascinating. Okay, let's talk about, next slide, please, some tips to avoid burnout for caregivers. Okay, allow for healthy expression of your feelings with one another. So if you're partnering, this is a way, if you can express yourself in a healthy way, this is a way that you can help to avoid caregiver burnout. Because very often, I think a lot of caregivers or care partners, hold a lot in because they feel like they have to be the strength of the family or the strength of the relationship. You need to allow for caregiving holidays. So there are times that when you're caregiving that you are going to need to figure out, and I know Orange County Department on Aging can help with this, you need to figure out how to get some kind of respite. You must take time off. Just like when people work during the year, if they work a traditional job, they need holidays and time off. Most people get 9 to 12, holidays a year and 2 weeks vacation, or at least a week's vacation a year. So as a caregiver, you are not expected to be a superhero and work all 365 days of the year. You must take time off. You need to encourage healthy independence for your loved one. So if your loved one can be independent in certain areas, like some of those activities of daily living, then, you need to encourage your care partner to do some things for him or herself. And that gives the care partner a break as well. And of course, to seek help through your local organizations. kind of pick up my pace a little bit here. Let's talk a little bit about the COVID-19 pandemic. Next slide, please. Next slide. Okay, so let's talk a little bit about how COVID-19 pandemic has impacted self-care. And we've touched on a little bit of these earlier. We are all more socially distanced and we are all more socially isolated. We are, of course, which we also mentioned, we are now providing more care for older adults. And some of those older adults may be battling or may be post, having COVID-19. There are some challenges and or fears around getting the COVID-19 vaccination. Some people who have been vaccinated have some fears and anxiety around it. Some are thinking, are we going to need a booster? What does that mean? And some of us are also concerned about people who are choosing not to get vaccinated. So there are some concerns around that. There are some economic impacts with the advent of the COVID-19 pandemic. People are underemployed or unemployed. Again, people are working more virtually. And then we have the sandwich generation who are feeling more squeezed, who are caring for children at home, who are virtually learning, and who are caring for maybe parents who are older adults. Again, we have caregivers who may be providing care outside of the home, again, and then who are coming home and providing care as well. Just a moment, I'm gonna just maybe pick up my pace up a little bit. Give me just a second here. Next slide, please. Okay. So older adults need more self-care, most especially during the COVID-19 pandemic. And I found this research online a little more than a week ago. So adults who are 65 and older are more likely to die and develop severe illness from coronavirus, which again gives us a good justification for practicing more self-care. Older adults are more likely to self-isolate, and this can exacerbate challenges for a population which is sometimes already sick, or a population who may already have chronic conditions. So even when living near family, some older adults may isolate from younger relatives to protect themselves or to protect their younger adults who are in their lives. And the older adult population is more vulnerable to anxiety, depression, and other negative consequences of loneliness. So we want to kind of keep that in mind. And hopefully with kind of learning about these stats, it'll kind of help us to take self-care more seriously. Next slide, please. Some strategies for coping and building some resilience during the COVID-19 pandemic and beyond. Let's talk about some of those. Next slide, please. Okay, there's a lot here. So I know the slides are going to be shared with you, but I just want to talk a little bit more about how COVID-19 has affected caregivers. So this crisis has likely heightened some of the challenges that caregivers face in their journeys, which include experiences such as feeling more alone, again, financial and emotional strains, and balancing work while providing care. The pandemic has disproportionately impacted low-income, diverse, and older populations, particularly those in long-term care facilities, which I do work in an assisted living facility. In doing so, the COVID-19 pandemic has amplified structural weaknesses in our long-term care and public health systems, including inequities and access to healthcare services, information, technology, resources, and workplace benefits. So what we have found for caregivers, most especially caregivers who are coming from more diverse populations and populations where we have more older adults, those in long-term care facilities, assisted living facilities, nursing homes, they have really felt the impact of this COVID-19 pandemic, more so than some of the rest of us. And you also have to think sometimes folks in these populations don't have access to the technology that some of us have, and they certainly don't have access to workplace benefits and resources that some of us have. So just wanted to highlight that as well. Next slide, please. Let's talk about the difference between coping and building resilience, and then we're going to talk about some ways that we can build more resilience in our lives. So when we're talking about coping, that's the ability to invest in one's own conscious effort to solve personal and interpersonal problems in order to try to master, minimize, or tolerate stress and conflict. So we're talking about coping, or some of those coping mechanisms that all of us have built up over time. Coping is about tolerating stress and conflict. When we're talking about building resilience, we're talking about the ability to return to our original state, the ability to adapt well to adversity, to adapt well to trauma, tragedy, threats, or even significant sources of stress. So what we're going to kind of move forward talking about is how can we build more resilience in our lives? So that ability to bounce back from trauma, to bounce back from adversity, resiliency, to bounce back from significant sources of stress. Next slide, please. Okay, so some strategies to cope and to build resilience is to take breaks during your day. It may sound very simple, but especially those of you who are providing care, working outside of the home, it is critically important that you take breaks during your day. As I mentioned before, I work in an assisted living community, and we have caregivers all day long in our community, because I kind of look at, folks who are punching in and punching out. And there are so many of our caregivers who are not taking lunch breaks, who are not taking 15-minute breaks. And it's required that if they're working for us that they take breaks, but they're so busy providing care that they're really not taking care of themselves. So I have to remind their supervisors to remind them to take breaks during the day. Limit watching the news and reading news online. I have become a news junkie over the past year and a half. So to kind of limit that, because that's a lot of stressors that are kind of coming at you from different modalities. And, my mom used to always talk about, news being bad news, and you can really only take so much of that. So if you can limit that a little bit, that's going to help you to also build some resilience. Of course, exercise, which we've already talked about. There's so many benefits to incorporating, to incorporate even, 10 minutes several times during the day, several times during the week. That's going to be of great benefit to your body and your mental and physical health as well. To seek counseling, therapy, and or support groups. To listen to your body. Our bodies have a way of talking to us and telling us exactly what it needs. Your body's going to tell you when it needs more rest. Your body's going to tell you when it's feeling a little bit more stress. So the more you get to know what your stressors are, you can tune yourself in and then work on doing something about it. And getting more physical, getting a physical, which we need to get back to our primary care providers if we feel like something is going on. Maybe lab work, maybe you're low on vitamin D, maybe your meds need to be adjusted. Maybe there's some kind of dietary or supplemental change that needs to be adjusted in your life. So you need to have a talk with your primary care provider. Next slide, please. Other strategies to cope and build resistance is to accept help. And that's another thing that seems very simple, but it's really hard for some of us to do, especially if we have developed this super person complex where we're supposed to, be all things to all people. And as a result, we're struggling. So, getting accustomed to accepting help, focusing in on what you can do, what you can provide. So as we talked to earlier, setting those boundaries and limitations and learning to say no. Setting more realistic goals, as we talked about, even in physical activity, not saying I'm going to go to the gym for an hour a day every day, but saying, hey, I'll get up a little bit earlier for a 10-minute walk, or I'll find a partner for support. So setting more goals that are more realistic. Getting and staying connected in various ways, not just virtually, but connecting more in person is really, really important to do. So to have more FaceTime with friends and family. And to get and to keep more social supports in our lives. So even with the mental wellness SRT, even if you all are getting together in person or virtually, you reap so many benefits by way of building resistance and resilience that way too. Next slide, please. Okay, some more resilience building techniques is to redefine your circumstances, right? So taking a look at your circumstances in different ways, finding more ways to frame your circumstances in more of a positive way, finding acceptance, accepting where you are instead of kind of looking in the past, looking forward and finding ways to accept where you are and how to live more, appreciatively as to where you are right now. Adapting to your new role, whether it's caregiver, care partner, or figuring out ways to provide more self-care for yourself, maintaining your friendships or relationships, becoming rebellious and radical about your own self-care, meaning that no matter what, you are putting yourself above other things and other people a little bit more, and realizing that that is not you being selfish, but that is absolutely necessary. Being playful and believing in serendipity, right? So as much as you can, being playful, laughing, and just understanding, where you are in this space and time. Building your team of supports, building your team of friendships, and building your team of folks who you can go to when you need support and when or if you need help. Identifying what you need help with the most. So prioritizing, what do I need help with the most? Would it be things like I need help with meeting my basic needs? Or would it mean I need help with kind of figuring out maybe a counselor I can go to? I need help figuring out, which primary care provider or which specialist to go to. I need help figuring out, whatever it is that's going on in your life, kind of identifying those things and then prioritizing them. And as you mentioned before, watching for changes in our body, watching for changes in our mood also. Next slide, please. Okay, some community service options. Let's talk about some of those. And I would love to hear at the end of our talk ways of, community services that you found since the pandemic or what you found. Next slide, please. Okay. So I'm going to kind of talk about a few more things that are not on the slide. First, of course, we have our area agency on aging, of which Department on Aging is one great way, of course, to find help and to find respite and all kinds of resources. They can help with career assistance, dementia support, transportation assistance, home health and information. So I know you all are always sharing, Department on Aging's resource with your family and friends, but also online research. There's AARP is a wonderful resource. And when I became 50, I became an AARP member, and the resources are incredible. Online resources, I get a discount card. There's so many cool things about being 50 and older. And there are so many online, resources for AARP. So I would encourage you to go there if you're not. There are elder care locators like a Place for Mom and other places if you need assistance with that. There are geriatric care managers that can kind of help you manage, some of your special needs as you or your loved one as you begin to age and age in community. That's a person who can direct you and guide you. There are geriatricians. Of course, those are primary care providers who can very specifically, help older adults because they have that specialized training. And then elder care attorneys to kind of help you in your maybe financial matters, your legal matters, as you age in community or as you're aging in place. Next slide, please. Here are just some other Orange County resources, of which I'm sure Department on Agency and the VC 55 Plus Division or Aging Transitions Division can help you with all of these things. So educational programming and home information, insurance and benefits counseling, options counseling, which is a wonderful resource. And I know, all of the social workers at Orange County Department on Aging are options counseling trained, support groups, social programming, transportation, and of course, there's a wellness division at Department on Aging as well. Next slide, please. It is time for our Q&A. I can't wait for us to kind of talk about what you all have been doing. And then the next couple slides are just some of the references and resources that I used in preparing for this presentation. And then my contact informations on the next slide, which I know Shanae will share with you all as well. So I would love it if you all have any questions and we can just discuss. And thank you, Shanae.
Thank you, Annie. So before we move into the Q&A portion of the program, I'm going to move through the slides so that they get recorded.
Okay.
And also, so if anyone has any questions that they would like to send in the chat, you can go ahead and send those because I'm monitoring the chat for Annie. And I will make sure that I send all of those questions to her. But the next few slides are going to be displayed so we make sure that we can get them in the recording.
Thank you. And Shanae, if there are not any actual questions, if folks just wouldn't mind sharing just some of their, practices, tips that they've kind of learned or tried to incorporate into their lives over the past year, that would be wonderful.
Absolutely. I think this is a great opportunity with all of the wonderful information that Annie has given us today to kind of explore some of the ways that we're using self-care and some of the little tips that we found that are working. I know, especially when you start looking at the previous year that we all had to journey through with the pandemic and how our entire lives were completely restructured. Finding ways to take care of self became extremely important because all of us did not have that access to the social supports the way that we did before.
Right.
I know it was pretty devastating for all of us with the Department on Aging to not have our centers open and to have our older adult, our community partners be able to come into the building so that we could all engage with one another. So trying to figure out other smaller ways that we could tap into our older adults' lives and make sure that they were caring for themselves. So I think one of the things that we tried is where often during the pandemic, you couldn't have those one-on-one meetings, but those phone conversations just to check in on one another became pretty invaluable for a lot of our older adults that were living alone. So I think that was, one way that we tried to make sure we were engaging people to make sure these were programs that they took part in so that we could get them to focus a little bit more on that self-care when they had to be alone. So yes, let's open it up. So if anyone has any comments or any questions, please feel free. You can unmute your mics or you can send me the questions. If you want to open up your cameras, you can do that as well. But we have Annie here that is willing to engage in conversation with us this afternoon.
No pressure.
I have a quick question. This is Bala.
Hi, Bala.
Hello.
One of the items we saw at the end is options counseling. What does that mean? Look for options, counseling options?
Well, I don't know. I saw that Kim was on the line. I don't know if Kim is still on the line, but I know through the Aging Transitions Division, all these social workers are options counselor trained. So I think by and large, and I'll let Shanae kind of jump into when you are ready.
I'm gonna let Kim take that over.
Oh, is she on the call? That would be perfect.
Hi, everyone.
Hi,
so
Kim.
for sure, yeah, options counseling is helping folks think through what's a good fit for and a good fit to support their well-being or the person they're caring for's well-being as they're looking at some kind of change to their either health status or their living situation, and kind of thinking through a lot of the areas of wellness that Annie spoke about today, kind of considering all of those pieces and finding the best fit. And it's so individualized, like Annie's presentation today, some things that fit for one person aren't going to fit for another person. So it's a very individualized approach to figuring out what's the best fit. for each individual person or the person they're caring for situation, and free service for folks in Orange County. And you can just call the Aging Helpline to make one of those appointments.
Great.
Thank you,
Thank you
Kim.
very much.
Thank you, Kim. And yes, I think it's really important when you look at options counseling, how much that taps into self-care. Putting those plans in place is definitely a process and a measure of self-care. So.
Perfect.
So Annie, I'm just curious, as you've been dealing with the pandemic and especially the high stress position that you have, working in an assisted living and being the Associate Executive Director, what key things have you found that work really well for you with trying to implement self-care?
Well, for me, I think the practice that has helped me the most is back in November, I started doing Pilates 3 days a week. Brand new to me. I'd never done it before. I did yoga 20 years ago, but yeah, I started doing Pilates about 3 days a week. And then for me, trying to shut myself down to sleep better, like practicing more sleep hygiene. Like I said earlier, I'm not really consistent with it, but really trying to be deliberate about getting off the phone at least an hour before bed, and to just kind of take some time to try to quiet my thoughts so that I can sleep a little bit better. So those are the two things for me that I've been trying to do, because my job is extremely stressful with navigating the pandemic, in an assisted living community. I've seen older adults that pass away and family members not be able to visit. And it's been extremely challenging. Now we have resumed operations. But even with that, we have other challenges with that as well. So those are the things I've been trying to do. Thank you.
I agree. I think one of the things that I noticed is learning how to shut down TV before bed. I don't think I realized, laying in bed and having the TV on, how much that impacts the quality of sleep you get and how much sleep that you get. But realizing that even just walking into the bedroom and not having the TV on at all and allowing myself to kind of decompress in the quiet, how much the quality of sleep that I get. So
absolutely.
So we do have a question that's coming in. And since Annie mentioned her doctor helped her talk about sleep hygiene, is that something doctors can normally help with, or do you need to see a specialist for that?
Oh, wow. That's a great question. And someone else may be able to chime in as well. For me, I went to my primary care provider, and she and I were able to talk through, some of the things that I needed to incorporate more in my life to help me. So the few things she mentioned to me, I haven't incorporated them all. As I said, she definitely said that it's important to kind of cool down my house, take the temperature down, because I guess you sleep better when your home is cool. So I try to do that. Of course, getting off of social media, cutting, turning that television off, and then coming up with bedtime practices or routines. So I'll try to read or do something like that. And I need that because my mind tends to race at night because my job is so busy. So those are just like a couple of things that she and I talked about, although I'm sure you can have a very similar conversation with a therapist, a counselor, or, even with your loved one as well, I guess, depending on what kind of particular challenges you have around getting to sleep at night. And for some people, quite frankly, the opposite is true. They're finding themselves sleeping more, 9, 10 hours, 11 hours a night. So that's, you absolutely should have a conversation with your primary provider if that's something that you're noticing as well, because that could be an indicator of depression, or maybe a mood disorder, or something else could be going on.
And I'm going to do a shameless plug here, because that's a great segue for us. We have another program that is being hosted by the Mental Wellness Senior Resource Team. in September. It'll be September 22nd, where we have Dr. Roth, who is a neurologist with UNC, that will be here, and her whole talk will be on sleep hygiene and getting good sleep.
Oh my gosh, please share that with me. I need to be there.
I will. So we're looking forward to having her on board talking about that.
Great, that's wonderful.
Any other questions or comments?
And Shanae, if any questions come up later, I'm happy to, if you want to email them to me, or I'll absolutely kind of answer.
Absolutely.
Sure.
Okay. I'm not seeing anything else come in, but Annie has been gracious enough to say if anything comes in after the fact that you email to me, she will answer whatever questions that you have. And I just want to take a moment and say, Annie, thank you so much for a wonderful presentation. And we are so grateful that you took the time to spend with us this afternoon.
Of course.
This is great information for us. So
thank you. Thank you so much. Thank you. Thank you to Janice. Thank you, Shanae. And thank you to the Mental Wellness SRT. I miss y'all. Hope to see y'all soon. Thank you.
Absolutely. And this program it has been recorded, so it will be uploaded to our Orange County Department on Aging YouTube page. So in the next few weeks, you can look for that link. And we thank you all so much for being with us and joining us. We hope you have a great afternoon. Practice that self-care that Annie talked so much about. And we hope to see you at our next program.
Thank you. Thank you.